needs to come with significant reform. I'm so pleased the government have actually appointed, I think, an Army General to look into how we do this.
Well, let me read you this tweet that I've got from somebody calling themselves Teacher. I've just been for a knee x-ray, 3 people in reception, 2 radiologists and 5 other nurses and health professionals hanging around doing nothing. I was the only one there. We're told the NHS is struggling. Could it be anything to do with bad and wasteful management? I get a lot of this every single day. People, when they go to use the NHS right now, particularly in GP surgeries or in these kind of settings, there's no patients around.
Well, for years, local councils have been forced to share their senior management with neighbouring councils to save money. Our NHS hasn't had to do that. And I think this extra money we put in, should only come with the proviso they've got to do that. The other point I kind of raised earlier, that we set up this big thing called Getting It Right First Time, GIRFT. And that was a big national effort led by Tim Briggs to look at the way we do procedures. And it was supposed to improve outcomes and save money. And he did this extensive work on all sorts of different things. And unfortunately, only some NHS trusts then went and adopted his guidance. There are plenty of NHS trusts who haven't adopted his guidance, saying things like, it doesn't work here, or it's not been invented here, we've got an alternative system. But why spend all that money and appoint those people with that experience to look into these things and then not adopt his findings? I think that's crazy.
Yeah, absolutely right. And there's all sorts of opportunities to do that. And this is what I mean by having a proper kind of conversation about the reform of parts of the NHS that aren't working properly. Because in this day and age, we've got no excuses really to not be more efficient. But it seems to me an awful lot of it is run as if we're still in the 1970s.
Well, I think that's right. I mean, one of the comments that came to me on the Health Select Committee is that we had during lockdown 3 years worth of innovation over 3 months. And a lot of that was forced upon the NHS, things like Zoom for outpatient appointments and things like that. But, innovation is not just about replacing GP appointments, via Zoom, GP face-to-face appointments via Zoom. It's about doing things differently. It's also making sure that our clinicians operate at the top of their profession. We want surgeons basically in the cath lab operating on people. We don't want to hear any more stories about surgeons only spending 1 day a week in the cath lab. They need to be there performing these procedures and getting us through this. We also don't want GPs focusing 40% of their time, and this is why I've got a bit of sympathy with them, 40% of their time doing fitness notes or releasing medical records. If the government can improve and legislate to save them all this kind of unnecessary bureaucracy, then that allows them to then go and see patients face to face and do the things that they're being paid for, quite frankly.
Absolutely. Just off on a different subject, really, Paul. The terrible events of last Friday resulting in the murder of Tory MP Sir David Amess have obviously shocked the world, really, probably shocked you guys inside Parliament more than anything. What's your view on sort of the whole debate around safety for MPs and constituency surgeries and that kind of thing?
Well, I knew Sir David Amess for 20 years, and that attack really did hit home, because just before I got the news of that attack, I was doing my own constituency surgery. I'm not trying to make this about me in any way, but it does kind of make you feel slightly vulnerable. But to be honest, I live in Peterborough. This is my city. This is where I go shopping, where I go to the pub, where I go to the restaurant. Am I going to have a burly minder every time I pop down, the Dog and Duck for a pint? I mean, that's just not practical. I think there's certain things you can do, about making sure people register before surgery appointments. But even on that, I'm doing a surgery a week on Friday in Asda. And part of the reason I want to do these surgeries, just as well as helping people, is also to be seen to be visible, and for people to see me as approachable. And I think the best way, actually, Mike, to honour Sir David is to follow his example. He was a hard-working, visible MP, and that's what I want to be.
Yes, and the other big story coming up next week, I guess, is the Rishi Sunak awesome statement. Obviously, a lot of people are very worried about tax rises, and the Tories keep telling us that they don't like putting taxes up, but they still keep doing it. What faith can we have in the future for this government if all they're going to do is keep asking for more and more money off us?
Well, look, it's no surprise to you, Mike, that I'm very much a low-tax Conservative. That's one of the reasons I joined the Conservative Party, because I instinctively believe that people know best how to spend their own money. That's what makes me a Conservative. And so that's when the Chancellor was looking for ideas and the spending review, my idea was very much what we're talking about today. putting some KPIs against this extra money that we're giving to the NHS. Otherwise, it's just going to go to the blob, quite frankly, and be spent on that middle management. And that is not a conservative way of doing things.
No, absolutely right.